All right, well, I'm going to go ahead and start. Thank you to everybody that was able to bring yourself away from your patients to be able to join us. My name is Amy Baxter. I'm an emergency physician and practiced pain management and emergency medicine for about 20 years. Today, what we're going to talk about is a new technology using mechanical stimulation to more comfortably help with pain and also to help with rehabilitation of stiff muscles and stroke. I'm going to start with half of a PowerPoint. I'll demonstrate the devices both in person and showing you, and then also on real humans who are graciously hanging out. And then at any time, if there are questions, feel free to answer. I actually anticipate this will take about 25 minutes, but I am available until you need me for any questions that come after. So without further ado, I'm going to go ahead and Deb, unless you want to say anything, I'll just jump into the deck. All right, so Pain Care Labs is our company, and we have a company that has two different business units that are focused on pain relief markets, particularly needle pain and musculoskeletal pain and rehab. We are the market leader in needle pain prevention, so we're very busy right now with COVID-19 vaccinations and over 35 million procedures. The technology that you'll see that helped reduce needle pain is actually very effective for musculoskeletal pain. So we are currently in over 5,000 US hospitals and clinics in 27 countries. The basic idea behind our technology started with the fact that people in general do not prefer electrical stimulation or opioids when they can do something that they control, that's fast, easy, and that is effective on contact. Our technology is effective, non-addictive, affordable, reusable, and most importantly, simple. So the mechanism behind the device started in 2006 when we realized that there was a vibration frequency that could decrease needle pain. The reason that it works is because we're buffering the pain signal, almost like noise canceling headphones, except for pain. By the time we got an NIH grant to study this, it turned out that you could figure out a specific frequency to actually cancel pain. So what we're doing is we're using the frequency that is associated with joints. It's the Pacinian corpuscle, and just like when you rub a bump elbow or you bang your hand with a hammer and shake it, you can eliminate or decrease pain. So the product line history that we came to create uses this mechanical stimulation frequency that's been proven effective in over 50 studies looking at sharp pain and expanded it into 4 different products for musculoskeletal pain. We have a plantar fasciitis unit, which I'm not going to talk about much, but more importantly for your uses, we have an elbow, knee, and a general unit. The units combine both heat or cold and the specific mechanical stimulation frequency. We are in the process of developing an additional mechanical stimulator to give stereotactic or to give the stimulus, the mechanical stimulation from 2 different regions. And we're actually right now NIH funded working on our low back pain device. So I'm going to stop right there to actually show you what the devices look like. So there are 4 different devices and they come in packages that look like this. So this is the extended. This is the flex, and this is the easy fit. And the place that you would use these in your practice is really twofold. Anytime you have someone with pain, you've got a situation where if they have cognitive difficulties, many times opioids are going to cause them to be belligerent. It's definitely going to mess with their sleep. It's going to be an issue. So rather than using an electrical stimulation product or rather than giving them an opioid, the first thing to try is mechanical stimulation. So I'm just going to show you the upper elbow unit first. So this is our easy fit, and it comprises a small unit that has a 10-minute timer. It's got a very high frequency of vibration, and you put it inside the pocket. And then on the back, depending on what you're treating, you're either going to use cold or heat. So the ice packs are single patient. They are very, very thin, And the nice thing about this is they are timed to melt. So the amount of thermal energy that's in each one is going to melt before a patient can get frostbite. So they're very hard because they have to transmit the frequency that decreases pain, but they're also going to turn into gel in about 20 minutes. So if your patient has a sore wrist, if they have arthritis and they're complaining about that at night, you can put it on and not worry if you get called away for an hour, and it'll shut off by itself, and then the ice pack is going to melt. So the other thing about the Easy Fit is that this is a device that can be put on by a patient themselves. So it's really simple. The other thing is it's going to cause pain relief immediately, so patients don't need to worry about whether or not it's working. They can tell. So there's a hole in the top, and a patient can touch the on-off button through that hole. You can touch it, they trigger it, and then it's going to stay on the place where they're hurting for any place between 10 or 20 minutes. So we recommend 1 or 2 cycles. So the times to use this for pain, for post-operative pain, if somebody has a bandage or a package dressing, then you can put it proximal. Because of the ice and vibration, they're not going to feel that through bandages, but the pain nerves are transmitted on a pathway. Any place in that pathway is good. So I'm going to have someone come and I'll show you how you would put it on. So say someone has arthritis or tennis elbow, and in addition to what else they're in the nursing facility for, they're also complaining about this. So if you're putting it, say they have a stroke, for example. So if there's a stroke, the actual recommendations are 2 or 3 times a day on the point of tension. We're FDA cleared to treat pain from muscular tension and restriction. So if there's a place that's restricted, you're going to put it directly on the belly of the muscle. Now, if they're sensitive to the cold on this side, it actually is 2-sided. This is a non-woven material. This is why you can't clean them between patients, but this is going to be a lot less tense than the blue side. It's going to be a little bit less, and if they can tolerate more, you can always switch it over. So you're going to compress it and then turn it on. And so by putting it on the belly of the muscle, patients, if they're aware enough, they can move it to the place where it's most tense or most painful. If you're doing it for a tennis elbow, golfer's elbow, you're going to put it up here. If they have bandages on an elbow post-surgery, the nerves are going to run in dermatomes here and here. So if the surgery is here, you can just put it so that the active unit is proximal to where the pain is. Thank you very much. For wrists or for carpal tunnel, you can put it on directly without necessarily having to use the ice. Now, if you're putting this on someone who has just had knee surgery, so this is where you would use our extended unit. So the extended unit, so there are a couple things. So our patient with the extended unit actually happens to have a meniscal tear. And one of the things we find is acutely after an injury or after surgery, ice is going to be the most effective. But when you have a non-acute or a chronic pain that has either come from arthritis or if it's come from just the natural evolution of a chronic pain, that's when you're going to get pain from tension, and that's where heat may be more helpful. The extended has a unit that will stay going for a longer period of time, and the extended also has a 4-chamber ice pack, also that still is the non-woven less side, the more intense side, but the ice packs are going to go in here. It takes about an hour to refreeze. What we usually have the facilities do is just write a patient's name on a Sharpie, and that's one way, or some places will just use them and dispose of them after each use. It really depends on how your facility best operates. So here is the ice pack. And again, if you're post-op, so if you've got a total knee replacement, for example, and someone's got bandages that are all the way up to here, then you're going to use it up here. So you're going to put it proximal to where that pain is. Now, on patients that have a perhaps a larger girth or maybe more bariatrically challenged, you can also add this is part of the flex. So what you can do is you can add this to the strap so that you're coming at it from 2 different sides. So if you have that extra, amount, you can get 2 units for them to put it on both sides. The other thing is, as we were discussing, if it's chronic pain, sometimes those patients are not going to want ice. So in those situations, we have a heat pack. And so the heat pack is activated. It's got, each one has a metal crystal or a metal plate in it. And the metal plate gets bent back and forth. And when it's bent back and forth with juice around it, it's going to cause a crystalline reaction. And that crystalline reaction is exothermic. So it is releasing heat. Now, one of the reasons that we use these packs, twofold. One is we can reuse it. So you can boil it and restore the energy so you can use it again. But the more important reason is actually because it will cause a crystalline heat. Again, in order to get the benefits of the mechanical stimulation frequency, MSTIM is going to work better through a solid. So you wait for that crystal to go all the way across, and then you can put it in the pack in the same way that you would have put the ice. You just put the heat. Now that, take that up, right there. And you can put compression on as much as you need. Where are you hurting actually? Real quick.
Just
right there.
adjacent to the patella.
Adjacent to the patella. So the heat is directly next to the skin, and then you can turn it on. Now, one thing about the units, the extended and the flex come with a unit that has a toggle switch. So these units are better for bigger body parts. You are going to want to go back in and turn these off. So typically 20 minutes is going to be a therapy cycle. The pain will last for about 4 hours after, but you're going to have to come in and turn this one off afterward. So the final place that, final device that's going to be useful for a lot, stay right there actually, that's going to be useful for a lot of your patients is the flex. So the flex unit, I showed you how you can add it to the extended, but it comes with a TheraBand. So there are a couple of benefits to the TheraBand. First thing is you can clean it between patients. And if you wanted to just attach this with a regular tourniquet, you could. It just may be a little less stable. The other thing about this is that we find that these are really useful for body parts that are more difficult to get to. So I can actually sit down right there. It's just your shoulder. So one of the places that this gets used a lot, this is one that I use, is for neck and shoulder pain. So using a heat pack, putting it right here, and there it is. So low back pain is another place where this is useful. And then hip pain. So hip pain is one we're actually written up in Everyday Health. Thank you very much. So those are the different devices. Those are how they are used. I'm going to go back real quick to the deck, and then I will have questions for anybody who has them. All right, so as you can see, we've got the 4 different units, and we're distributed by, we're available on the Pain Care Labs website. I think Eric is your distributor, so we've got Extra Tools that's distributing. But the benefits of the devices compared to any kind of TENS unit or something else with neuromuscular or electrical stimulation. First thing is, it is portable, it is lightweight, and it is really simple. There are no leads, there's no concern about pacemakers, there is no reason why you would be worried about a patient who may not be there all the time or may have some sundowning. They're not going to be able to hurt themselves with this, and it's very easy for them to use it. The one-touch activation is also very easy. It's on or it's off. Because it has 2 AAA batteries, patients can reuse them themselves. One of the best ways that I would recommend incorporating this into your normal trajectory is if there's a patient that you're trying to wean from opioids, or for whatever reason you don't want to give opioids and they've got a condition with pain, giving each of these patients the largest unit, which would be the extended unit, that will allow you to be able to put it just about anywhere they hurt, and they can use it throughout their duration. So if someone is saying they need to get an opioid pill, it's really easy to say, look, let's try this first, and in 20 minutes, if you don't feel better, we'll come back. Most of the time, they're going to feel better or be asleep. There are additional benefits of high frequency vibration, and the high frequency mechanical stimulation we're using is about 200 hertz. So for one thing, it increases blood flow. It is vasodilatory. That's why we've got the compression straps if you're using it immediately post-op, because you don't want to put it on someplace without compression when you've got an acute injury. That said, it overcomes the concerns you have with ice by increasing blood flow. So you don't need to choose between anti-inflammatory or blood flow, you've got both. Second thing is that high frequency vibration for muscles has been proved to decrease delayed onset muscle soreness, and it also increases range of motion. So if you have a patient who's tight or stiff, before you do physical therapy, use either the vibration and heat or the vibration and alone for about 5 minutes to warm up those muscles and to get the myocytes and the muscle fibers separated painlessly before you start working with them. The other thing is that while our devices have not specifically been studied for speeding bone repair, there's a lot of research on mechanical stimulation in the 150 to 200 hertz frequencies, improving bone and muscle repair. There are over 50 published clinical trials dealing with the acute sharp pain reduction. In addition, one study of 14 patients with ACL reconstruction found it reduced opioid use by 35%. Another study looking at physical therapy comparing just the MSTEM component with the comparing it to TENS unit in a crossover trial, that study found that our MSTEM frequency was 2 to 3.4 times more effective than a TENS unit. So what you're looking at here is this pain reduction by modality. It works best for overuse injuries and for things around joints and spine, because that's where most of your Pacinian corpuscles are. But on average, the VibraCool was 2.2 out of 10 points better pain relief than a TENS. So here's kind of the different places we see it used in prehab and rehab. If someone is going to be going for a surgery, or if someone needs to be rebuilding their quad strength so that they can stand, walk, and leave, that's when you're going to put it directly on the quad or on the IT band so that you can get those areas increased. Now, one thing that's interesting is the high frequency vibration in one study of osteoarthritis actually increased muscle mass when used by itself. MSTEM has also been shown to help stroke recovery and pain from stroke. So these are places where putting the MSTEM on either alone or with the heat is going to be useful. Tendonitis, fasciitis, 3 times a day for 10 days actually has eliminated elbow tendinopathy, and plantar fasciitis can take between 10 and 20 days. So if you've got someone who's got a really chronically stiff area or a muscle that you just can't get into, I'd put this on before you work with them, and then again after if there's any kind of damage with the ice. We've been listed in practical pain management for telemedicine and telehealth about 10 times, one of the top pain devices on the market, one of the top physical therapy devices on the market for home use. So this is a great thing if you've got someone who's going to be discharged, but you're a little worried about them keeping up their regimen. Having a device that they go home with is also a great way to keep them from bouncing back. And then we've got extensive consumer reports from, consumer support from older people and younger people. One of the fun things is we were available on Good Morning America twice, and we sold out in less than 24 hours, and our return rate is much lower than their normal. So once people get these, they like them, they use them, they're easy to use. So I'll be happy to share this deck with people, but for right now, I'd like to let people ask any questions that they want. Show the devices again if people have questions or want to see them. And is there anything? I'm going to make sure you're all unmuted, but thank you for your attention, and I'm happy to answer any questions.
Thank you so much, Amy. I know a couple of people are going to use the chat line because they're in a noisy area. So you might get some questions that way,
Right.
but
and the other option is to put them in the chat. So we have one question. Has this had an impact on anyone with low or high tone or spasticity? This is going to be more helpful with people with spasticity. This is going to be better with people that have high tone because it is specifically FDA cleared to address pain from muscle restriction and muscle tension. So the thing is, when you have spasticity and you have the tight muscles, the myocytes are going to be stuck together with some degree of lactic acid. And when you're trying to separate these fibers, if the patient starts moving them, you can rip them and cause re-injury, and cytokines come out, and you exacerbate the problem. So the high frequency mechanical stimulation is going to separate those fibers without damaging them. So that's the hypothesis, which is why they think high frequency is particularly good for late onset muscle soreness and for spasticity. Can it help with impaired proprioception? This is it's a really good but complicated answer. So what vibration does is it actually lowers the firing threshold for sensation. So there are studies looking at low amplitude vibration as foot pads that actually improves proprioception and balance in older people. So by having it's called stochastic, but by having a sort of a random vibration frequency, it makes those nerves more ready to fire. So it takes less intensity of motion to fire the nerves for proprioception. That said, this specific frequency hasn't been tested to my knowledge for proprioception. So we're working with this kind of energy medicine in a lot of ways, but I do know that particularly for pain, the specific frequency is critical. You have to be between about 180 and 250 hertz to really get that mechanical corpuscle for pain. So for proprioception, most of the studies now are using more in the 20 to 80 range. So does this help with impaired proprioception? Don't know. Certainly it does help remyelinate from stroke. So the studies looking at vibration only for stroke recovery, there's a great deal of improvement. The likelihood is that you're remyelinating new areas and helping speed the new pathway formation. But I think the best answer is possibly. Contraindications. Oh boy, we got a lot of questions. Hold on, let me go back. All right, got the spasticity. Billing code. This is a musculoskeletal therapeutic. It is billed with, it's covered by FSA and HSA, but it would just go under a general manual therapy with presence. And so that there isn't a specific HCPCS or CPT code for it. So it's just a generic code. What are the contraindications? Are just the ice. So if you have someone who has urticaria, who has sickle cell that is triggered by ice, or CRPS or Raynaud's syndrome. So if they have a specific sensitivity to ice, then just don't use the ice. Otherwise, there are no contraindications. And yes, it's absolutely safe for pacemakers, internal stimulators, pain stimulators, baclofen pumps. Totally fine for any of those things. There's not a concern with emissions or with other things. You're not putting electricity in. One of the other reasons it's really effective and more effective than TENS, in addition to being in the right frequency, is that a mechanical stimulus is going to go into the muscle, but it's also going to spread laterally, and then you're going to have a decay of the vibration frequency as it spreads through muscle tissues. So you're not going to get a transmission of electrical stimulus. You're not going to get any kind of interference because it really is a physics thing. It's just a mechanical thing.
I had a question. Earlier in the presentation, you had mentioned that your ice packs, you have it timed out to help prevent frostbite. But for the heat packs, is there anything to, well, we know you can overheat it and there's possibility of burns. So I'd be concerned about that. So is there any mechanism within the gel that you're using to help with that? And if not, if you were to put like a towel or something underneath it, would that decrease the efficacy of the vibration frequency that's being transmitted to the area?
Yeah, so the amount of gel that's in these packs is a relatively small amount, but we don't have a specific temperature amount. This will not burn on normal skin, but if you have someone who has a sensitivity, some people are going to feel discomfort from the heat with that. A towel is going to absorb the vibration, but what I would do is if there's any kind of a bandana or a thin, whether it's nylon, bandana, something flat, you could certainly use a chucks, and that will transmit the vibration without problems. And so I would want, with the heat packs, I really would use those with patients who can talk to you and patients who are able to tell you if something is too hot. That we have a more intense pack that can cause enough heat that you need to put something in between it. This one rarely does. I mean, the flip side of that is this one's not all that hot, but you certainly could put a thin cloth or a chucks or even actually a paper towel under it to give you an extra layer if you needed to for the heat pack.
Cool, thank you.
You're welcome. Good question. It makes me realize I need to find out what the maximal temperature that's transmitted to the skin with these is. Do you know?
I don't. I was just trying to think about that. I'll have to look
Yeah, I
at
think
that.
it's 110, but I'm not positive. So we'll get back to you and find out exactly. But we haven't had complaints of it being too hot. We've had people who wanted to get the more intense ones to make it hotter, but we haven't had too hot complaints on that one.
Hey, Dr. Baxter, can you hear me?
Yes, Corey, I can.
Great. Well, first, great presentation. This is really good. And I think you're uniquely able to answer some physiological questions. So with ultrasound, it's also kind of a mechanical stimulation. So one, I have a couple of questions. One of the depth of the vibration is one, and also so ultrasound's theorized to increase cellular permeability. Does this also have a similar effect with that vibration?
Such good questions. All right, so the depth of penetration is going to be about 4 centimeters. And so that's part of why if you've got someone who's larger, you may want to have a stereotactic, have a flex and the unit together so that you've got some degree of them pushing in. Now, we're really just looking at macro effects. So there's likely some penetration that goes further than the 4 centimeters, but we haven't tried to get down that far because most of the pain nerves are more superficial. So certainly we have people that are large who use it for their joint pain, who are probably bigger than 4 centimeters deep where the pain is, and it's still effective. But I don't know how much of that is some inflammation that's more superficial. Now, with the cell permeability, this is actually not intended to deal with cell permeability. There are something called integrins, which are little shock absorbers that are on the outside of the cells, and they transmit physical pressure and touch to cause growth in the cell, so anabolic things. Best way to think about this is push-ups or something. If you are repetitively putting mild strain on tissues, those tissues are going to grow. So with mechanical stimulation, you're stimulating growth hormone, you're stimulating testosterone, you're stimulating expression within the cells that comes directly from these integrin proteins, these shock absorbers outside. So we're not changing the permeability. What we are doing is just transmitting the physical pressure, and there may be a mechanism that ultrasound is using that causes permeability that is because it's on a much, much higher frequency. But at the low frequencies, this is really getting more to the way the body is designed to respond to minor stresses over time. Oh, wounds. So here's a question. And Corey, did I finish, or is that a good enough answer?
No, that's a great answer. Thank you.
All right. So can it be used to stimulate circulations near wounds? Fantastic question. There's a great study looking at diabetic ulcers and vibration alone. So they didn't use heat, they didn't use cold, and they were only using about 100 hertz, but it did improve the healing. So we have gotten patents for healing, and it's very likely because we're increasing blood flow and you're stimulating growth that you're going to help wounds. What I can definitely tell you is you're going to decrease the itching, because itching is transmitted on the same A delta nerve that pain is transmitted on. Wounds, I would certainly be using it on mine if I had one, but to this point, I'm only aware of the one study with diabetic ulcers and the 100 hertz. But we're definitely, I mean, we've only had the VibraCool around for a couple of years, so to specifically study it in a lot of different areas, we don't have stuff that's specifically on our devices. But conceptually, physiologically, it's one of the areas that we intentionally got our patents for.
Hey, doctor, I have another question for you. So with the application of it, is it as effective? Can you use it with movement with that joint, or is it mainly for pre or post activity? So in other words, like if I have a patient, or even if it's a younger patient that's a little bit more active, especially in an outpatient setting, could it be placed on the joint or muscle belly while they're doing an active movement with it? Is that recommended, or is it better for either pre and post only?
So we have a lot of physical therapists who are using it proximal when they've got a lot of pain that's limiting the motion. So when they know the patient should be able to be getting to a certain degree of flexion or extension, but it's limited by pain, and they feel like the patient should be able to do it by that time, then yes, you can absolutely put it proximal to the joint with the ice and vibration together to help with the tolerance of the PT to get that stretching in, to get that range of motion. If they're doing something that's bouncy, then no, it's not going to stay on well enough. The devices are not, they don't have anything sticky in it to go on it. We're actually working on a new embodiment that can go under a brace. So this one is going to be available by October, I believe, is when we get them. So we'll probably have them on the market before the end of the year. But this one is designed to go under like a neoprene brace, so it'll stay in place where you want it. If you're running, if you're trying to activate the terminal belly of the muscle, like in the IT band, that sort of thing. So you can use it for that if it's low impact, but if someone's going out and doing high impact, it's probably not going to stay put.
Okay, that's great. Thank you.
Walking around, certainly. I mean, we have, all of us who work here who have injured our knees at some point will wear it around the hive, and while we're just doing whatever. The hive is what we call our office. We'll wear it around and while we're walking around, but if we were going to go exercise with it, it'll fall off while you're running.
Well, selfishly, I'm thinking for myself as well. So thanks for answering that.
Yeah, hopefully. So I'll have something for you to put under tight running shorts by October, but right now you can't use it while you're running. You might be able to keep it in place under if you put the whole thing under like biking shorts or something, then we do have people who bike with it to keep it on. Yeah, Nicole actually works with a lot of our hospitals and ASCs, so she's got the questions that we tend to get on the ground. So I mean, skilled nursing facilities are a little bit different issue. I think that one of the best things about this for a skilled nursing facility is the fact that you can put it on someone and not have to worry about it being safe, and that you can use this as something that will instantly soothe someone who is repeatedly asking for opioids and gets belligerent because you're not giving it to them. So I think that this is a really good place for a place when you need pain relief, but people may not remember if you've given them pain relief recently. They will remember that they have this on and it's going to be effective enough. So if they're there for their hip, but their wrists are hurting so they can't go to sleep because of their rheumatoid arthritis, that's a great place where having one of these around can make it easier on everybody in the facility.
Yeah, and I think the key is remembering it is easy to use. I mean, that's one of the best things that we've heard from so many people is that they aren't messing with any buttons, gadgets. One button, turn it on, that's it.
Yeah, I mean, and this may not be as big a deal for your population, but portability is the other big thing that people talk about. The fact that they don't have to be stuck to a wall or plugged into something. And we have some people who've got sacroiliac pain, and so sacroiliac instability can just shift at any time, and it's excruciating, and then you're stuck, unable to walk in the middle of traffic or whatever. And so being able to carry this, putting it right on that sacroiliac joint where the instability is, because it's mechanical, it can shift the nerve out of that position, and has given a lot of people who are older amazing freedom when they were afraid to leave because they didn't know when they were going to have the shooting pains come in. So again, that may not be as relevant to your population, but that ability to give someone something so that they can get around a little more and increase mobility, that certainly helps with strengthening and helps with getting people home.
I just want to thank you so much, Dr. Baxter, for sharing all of this with us. We do a lot of outpatient therapy as well with our patients who return back home and with people who live in assisted living facilities. So this is just like right in line with something we could really use. So thank you so much. And thanks to Eric Parcells for introducing us to you and being our partner on this.
Yeah. And thank all of you for making time on a Friday, and particularly just for all that you do. My uncle very recently had a prolonged illness, and the whole family was just so benefited by having the kind of skilled nursing care and by having people who were comfortable and compassionate working with a population that can be cantankerous, cranky, and hard to tolerate when they're irritable because they hurt. So I really appreciate what all of you guys do as well.